The catcher's dilemma. As you guys can see in the pictures presented, there is a myriad of catcher stances: receiving on one knee, everting the feet, squatting with most of the torque on the back leg. The list goes on and on for catchers trying to find the Goldilocks zone of an appropriate yet safe and comfortable position. Given that in a 15-year Major League Baseball career, a catcher squats around 100,000 times, mitigation of injury should be at the forefront of sports medicine research. Unfortunately, little research has been completed. Currently, we know that prolonged squatting has been demonstrated to be a risk factor for meniscal injury and osteoarthritis. The posterior horns of the menisci become impinged between the femur and tibia during deep flexion, potentially leading to injury over repetitive insult. A study in Chinese men and women who squatted for 120 to 180 minutes a day had a 70% increased likelihood of having TF osteoarthritis compared to those who squatted 30 minutes a day. In a study conducted on knee savers, despite their popularity as the most prominent relief mechanism for catchers, researchers found no change in frontal plane lower extremity kinematics. Lastly, research has shown that non-contact injury rates for NCAA softball catchers are higher than baseball catchers, and 20% of those injuries occur at the knee and ankle.
As biomechanists and with two UVA catchers on our team, we pondered if fatigue has any impact on frontal plane kinematics. With collegiate catchers being potentially at the midpoint of their careers, if we see fatigue being deleterious to catchers on the acute day-to-day operations, this could serve as a point of consultation to coaches on how to best manage and protect their catchers. Therefore, the purpose of this project is to determine how fatigue affects knee kinematics in collegiate baseball and softball catchers.
The question we wanted to answer was if fatigue accumulation could lead to increases in knee and hip flexion, potentially causing the catchers to be more prone to injury. To test this question, we had 5 male and 1 female catcher from the University of Virginia varsity baseball and softball teams participate, in which we used ImageJ and an iPhone 6 camera to take pictures of the athletes in a frontal and sagittal view. Prior to the images being taken, we surveyed them on their injury history, their degree of fatigue pre and post practice, as well as their present pain pre and post practice. We took the images on 2 separate days for the baseball catchers and only 1 day for the softball catcher. We measured changes in hip and knee kinematics pre to post practice from the sagittal view, and we also took pictures in the frontal view but did not take a measurement, so we just wanted to see if there were any changes in internal rotation or eversion, inversion of the foot or anything of that nature. To see if our results were significant, we ran an unpaired t-test for the hip and knee flexion values.
The table presented displays the self-reported values of degree of fatigue for each player for both before practice and after practice. As expected, the fatigue values increased from pre-practice to post. Any pain that the athletes were experiencing before or after practice is also displayed here. There seemed to be a slight increase in pain reported by the catchers post-practice. However, the effects of this was not beneficial in predicting the results, as those who were experiencing pain did not show a difference in hip and knee displacement compared to those who were pain-free. These graphs represent the 10 measurements of angle displacement of the knee and hip for each individual athlete. The blue bar represents the hip angle, while the orange bar represents the knee angle. Positive values represent an increase in joint extension from pre to post practice, while negative values represent an increase in joint flexion. The graphs that are vertically stacked on one another are of athletes who performed 2 separate trials. The first day of testing for these athletes is on the top row, while their second day of testing is directly below it on the bottom row. The 2 graphs at the bottom are of 2 catchers where we were only able to take 1 day of measurements. As you can tell, the results are quite inconsistent across all the athletes. For the athletes who were measured on 2 separate days, their measurements for day 1 were not good predictors of their measurements for day 2, as those values varied as well. The results for the 1 softball player we recorded is on the bottom right. She presented an increase in both knee and hip extension post-practice. However, this is hard to compare to the male athletes since their results were inconsistent and we were only able to test 1 softball catcher only 1 time. In order to test the statistical significance of our results, we ran an unpaired t-test for the pre- and post-practice hip values, as well as the pre- and post-practice knee values. As you can see, the p-values we recorded were very large while the t-values were very small, which concluded that our results were statistically insignificant.
Because so little research has been done on the subject, its effects on race and gender are quite difficult to quantify. As we stated before, we know that softball catchers are more likely to sustain non-contact injuries than baseball players, and the data has backed this up. This could be attributed to a variety of issues which may be hard to specify due to the great variance in catching styles among players and anatomical differences in gender. When we look at these issues from an ethnic perspective, we have an even wider set of issues essentially related to data available. 27% of Major League Baseball players are born outside of the United States, and while exact numbers cannot be found, there are approximately 18 catchers in the league that were born outside of the United States. While baseball has been littered with issues of diversity for years, specific numbers on positional injuries by ethnicity were essentially nowhere to be found. And this can be partially attributed to the wide range of ethnicities represented in baseball, but primarily is due to lack of research and subsequent information. Studies have shown in conclusion that the majority of injuries to professional catchers are non-collision injuries, but there does not seem to be a correlation between ethnicity and injury in Major League Baseball.
Study findings indicate that muscle fatigue accumulated in baseball and softball catchers from pre-practice to post-practice did not significantly change hip and knee kinematics. This means that collegiate catchers in the study may not have experienced a potentially injurious increase in hip and knee flexion as a result of the duration of time spent in the squat position required for catching. So how do the results compare to current knowledge and literature? Well, currently there is no literature that has studied the effect of fatigue on hip and knee joint kinematics in collegiate baseball or softball catchers as it relates to injury or injury prevention. However, various biomechanical hypotheses have been investigated as they pertain to the relationship between lower extremity kinematics and injury to bone and soft tissue. For example, a deep squat position creates increased compressive forces, which could be potentially deleterious to menisci or articular cartilage. Also, athletes at risk for femoral acetabular impingement who may have a cam or pincer type impingement could be at risk for tissue damage from excessive hip flexion. So while our study did not result in significant findings, it is worth recognizing that collegiate coaches should communicate with catchers to ensure they are not incurring any chronic injuries to the hard and soft tissues of their knees and hips. This study was limited by the fact that fatigue accumulated over the duration of the practice was self-reported, so there is some concern over underreporting, and that the practice may not have been significantly physically exerting enough to see potentially deleterious changes in the kinematics. We were also limited in the number of athlete exposures that we were able to measure, and the variability in the camera angle and camera distance from the catcher resulted in some changes in the way the picture was photographed. And lastly, there is some variability in the catcher's foot placement when taking the pictures as well.